This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin helps to thin and loosen mucus in the airways, clearing congestion, and making breathing easier. Dextromethorphan works on the brain to reduce the urge to cough. If you are using this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Tuss, it's important to follow the directions given by your doctor or on the product package. If you have any questions, consult your doctor or pharmacist. Make sure to drink plenty of fluids while taking Tuss to help break up mucus and clear congestion. The dosage of Tuss will depend on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take the medication more frequently than directed. If you're using the liquid form of Tuss, be sure to measure the dose carefully with a special measuring device or spoon. Avoid using a regular household spoon, as it may not provide the correct dose. For powder packets, empty the entire contents onto your tongue and swallow. If you're taking the capsule form, swallow the capsule whole to prevent a bitter taste. It's crucial to use Tuss as directed and not to misuse the medication, as abuse can result in serious harm such as brain damage, seizure, or even death. Do not increase your dose, take it more often, or use it for a longer period than directed. If your cough comes back or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, it's important to inform your doctor. These symptoms may indicate a serious medical issue. If you think you may have a serious medical problem, seek medical help right away. If you experience dizziness, drowsiness, nausea, or vomiting while taking Tuss, it's important to notify your doctor or pharmacist. However, many people using this medication do not have serious side effects. While a serious allergic reaction to Tuss is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. As for the best time to take Tuss, it's important to follow your doctor's directions. Be sure to discuss with your doctor the daily dosage that is right for you, and any concerns you may have about the medication. Before taking Tuss, make sure to let your doctor or pharmacist know if you have any allergies to Guaifenesin or Dextromethorphan, or any other allergies. Also, inform them about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how the medication affects you. If you have diabetes, liver disease, or any other condition that requires you to limit sugar or alcohol, speak with your doctor or pharmacist before using the liquid forms of Tuss. Additionally, the liquid forms and powder packets of Tuss may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this medication. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when clearly needed, and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using Tuss if you are breastfeeding, as it is unknown whether Guaifenesin or Dextromethorphan passes into breast milk. Drug interactions can change how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with Tuss may cause a serious and possibly fatal drug interaction. It's important to avoid taking specific medications during treatment with Tuss, and most MAO inhibitors should not be taken for 2 weeks before treatment with Tuss. It's best to ask your doctor when to start or stop taking Tuss. One product that may interact with Tuss is rolapitant. Guaifenesin and Dextromethorphan are available in both prescription and non-prescription products. It's essential to check the labels of all your medications to ensure you are not taking more than one product containing Guaifenesin or Dextromethorphan. Guaifenesin may interfere with certain lab tests, potentially causing false results. It's crucial to make sure lab personnel and all your doctors know you use Tuss. If someone has taken too much Tuss and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed Tuss to you, it's important to follow their instructions and not share the medication with others. It's also important to keep all of your medical and lab appointments to ensure that you are getting the full benefit of the medication. If you forget to take a dose of Tuss, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Tuss, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom or freeze the liquid forms of this medication. Different brands may have different storage requirements, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. As for disposal, it's important not to flush Tuss down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.